In the program with Senator Kent Conrad of North Dakota, who also is a member of the Senate Finance Committee. Senator, thank you for being with us.
Good to be with you.
Your Finance Committee, it looks like the bipartisan health care bill is crumbling, maybe even dying. Is that a death knell, or can you write a bill on the Senate floor?
You know, I don't really think that is what's happening. I think what is happening is a search for alternatives that is very disciplined, tedious, but critically important. You know, I think it's much more important we get this right than we get it done by a certain date. So actually, I've thought the last 3 days, the sessions were incredibly productive, and that this is moving in the right direction.
And you think you can get a bipartisan bill out of the Senate Finance Committee sometime, say, this summer?
I do. You know, I believe that we could get it out of the Finance Committee. I don't think we'll be through the floor during this work period. I think that's too big a lift. Yeah, but that really isn't that important. I believe the
But
Senate,
maybe by the August recess through the committee.
Yeah,
okay.
I think that's entirely possible.
I think there's a general agreement that you have to raise probably in the next decade somewhere between $400 to $500 billion of new revenues.
Yes.
Of all of those options, all difficult, which 2 or 3 strike you as the most politically viable?
Well, the most politically viable are things like information reporting for corporations.
That doesn't get you any revenue, does it?
It does, but it's modest.
Yeah, okay.
In terms of the bigger pieces of the puzzle, I think the exclusion policy still has to be very seriously considered. The tax subsidy, the income tax subsidy to health care over the next decade is $2.4 trillion. We're talking about just getting a tiny fraction of that.
Of the Cadillac plans.
Cadillac plans. Those
but Harry
that have
Reid,
a
your
value.
leader, didn't Harry Reid this week say, no, take that off the table?
Well, what he said was that there are many in the caucus who are very wary of going down that direction, and we understand. But look, $2.4 trillion of tax subsidy to health care, and to say we can't touch any of it? How about plans that are worth more than $30,000 a year?
So that probably will be part of it, you would think.
Well, I think it has to be on the table. In terms of other things, you've got lots of options. One of the things we've done is go over a complete menu of options. We've got, for example, pharmaceutical industry, a manufacturer's fee on the pharmaceutical industry. I think that is going to be front and center in terms of a consideration. The industry has already agreed to a fee at some level. The question now is at what level?
You understand this concept of scoring budgetary issues as well as anyone, probably nobody else does. But this bill has to be revenue neutral. It has to be scored. So therefore, these savings have to be actual. The CBO has to say they
have to be for real.
There are a number of people who say, look, there are some savings that we think we'll get. We can't guarantee they won't be scored. So what we ought to do, we ought to have a fail-safe fallback that says if we don't achieve certain savings by 4 or 5 years, there will be, in essence, a base closing commission type that would automatically make cuts. Can you support something like that?
I can, and I do. Look, as a country, we're headed for the cliff. We're headed for a debt 100% of the total size of our economy. That's where we're headed. And the big 800-pound gorilla in this fiscal problem is healthcare costs.
And so this agency would, if you achieve the savings, fine, you don't need it, but if not, this agency would automatically, whatever it is, whoever appoints it, would automatically make the cuts, down the road.
Well, with one change, they would make the cuts. Congress would have to make a final determination.
Right. Like
Congress would, Congress would have the responsibility to vote yea or nay.
You were on this show in January, Senator, and you expressed skepticism over the Obama claim that the stimulus package would create 3 million new jobs. It appears that you were prescient. Unemployment now is heading north of 10%. Is it time to think about a second stimulus?
No, I don't think it is. Look, only about 15% of the stimulus package is out there.
So give it time, in essence?
Yeah, over the next 12 months, there'll be another more than 50% of the package, about $380 billion over the next 12 months. So I think the package really is not working fully because it's not been deployed in any serious measure at this point.
Top priority for Kent Conrad, dealing with long-term chronic budget deficits. Social Security have to be on the table. What do? Cut benefits, increase taxes, or is there a third alternative?
There are lots of alternatives with respect to Social Security. Increasing the age modestly, and not for those who are near retirement, clearly has to be part of the package, because we're living so much longer than when Social Security was started. So that's got to be part of it. Adjusting the inflation index that's applied to Social Security. Many economists say it's just not fully reflective of the inflation that actually occurs. It overstates it. Even by a small amount over many years makes a big difference. But the truth is, Social Security is a relatively small part of our problem. By far the biggest problem is the health care accounts and the tax system.
Right.
Because the tax system is not collecting anywhere close to what's actually owed.
Can Barack Obama keep his pledge on the revenue side not to increase taxes for anyone making less than $250,000 a year and still deal with that long-term chronic deficit?
He can keep it if the pledge is on income taxes. You know, the interesting thing is, if you just collected the taxes that are due under the current system, you wouldn't have a structural gap. But we're only collecting about 76% of what's actually owed. And the reason is this income tax system has become such a patchwork, such a crazy quilt of provisions. And it's being, let's say, evaded, avoided by these offshore tax havens, by abusive tax shelters, in a very, very significant and growing way. So my own view is we've got to fundamentally change the tax system.
So final question. Is it probable, do you think, over the next couple of years that you will turn to a consumption or a value-added tax as at least a partial replacement to the income tax?
I think we very seriously have to consider a value-added tax in combination with a high-end income tax to keep the system progressive.
Likely Congress can do that?
Look, if you look at the leakage in the system, if you look at our competitive position in the world, if you look at basic equity and fairness, and if you look at how serious our long-term debt and deficit situation is, it's got to be on the table.
Senator Kent Conrad, thank you so much for being with us.